Good evening, I'm Ian Hannamansing. Tonight, Quebec's COVID curfew.
People have to realize how very tenuous the situation is.
Eerily empty streets as Quebecers are required to stay home and stay put.
This is not the solution.
With other provinces bracing for new restrictions, we ask, do curfews work?
If anything, our doses are increasing, not decreasing.
Questions persist about Canada's vaccine supply and demand as the federal government reveals it opted not to buy millions more Moderna doses.
They're virtually identical.
Why a quick trip for coffee from Tim Hortons prompted father and son inventors to go public.
At first, couldn't believe it.
This could be an absolute, bomb to some teams.
The Canucks benched for a day after possible exposure to COVID-19. Is the NHL's Canadian division on thin ice? This is The National. For the second night in a row, people in Quebec are under curfew. With limited exceptions, residents are not allowed outside until 5 a.m. tomorrow morning. It is a drastic move, an attempt to get COVID cases under control. And this is how it looked. These images are from last night, Saturday night, in Montreal. A city suddenly turned into a ghost town after 8 p.m. Quebec's curfew is a Canadian first, but it may not be the last. So how did that first night go? Valeria Corey-Minocchio shows us how police, protesters, and the public reacted.
Montrealers today getting in outdoor time before they had to return home for night 2 of the curfew. Come 8 p.m. last night, some say the city felt different.
Near our house, there's definitely more action usually. There's a lot of people playing music and stuff like that, and people kind of like yelling on the street. That wasn't really the case.
So we tried to go to the grocery store and it was closing right down at 7:30, so it was kind of like a weird thing to not have, I guess, the freedom to go out and run out and get some food.
Police services say most Quebecers were compliant last night, but they did hand out more than 250 fines, which can range from $1,000 to $6,000. Some of them to protesters in Montreal, Quebec City, and Sherbrooke. There are some exceptions to the curfew, like for essential workers. And last night, Montreal police say they assisted homeless people rather than ticket them.
Capacity is very, very limited right now.
The challenge now, to ensure there's enough shelter space for everyone every night.
Last night, literally, almost every bed in the city was taken. We're going to have to probably find new space, new staff.
The curfew is part of a, quote, shock therapy, says the Premier, meant to curb the spread. The big question, will it work? This behavioral medicine expert thinks it could.
Having very specific, you should do this and you shouldn't do that, provides people with clear guidance.
The hope is that all this will ease the burden on the healthcare network.
I think people have to realize how very tenuous the situation is and that we really do have to do something now, because leaving it alone means that by January, beginning of February, we might find ourselves in a infinitely worse situation than we are now.
The curfew will be in effect until at least February 8th. Valeria Corey-Minocchio, CBC News, Montreal.
Those of you in Ontario may be watching what's happening in Quebec very closely. Today, Ontario broke yet another single-day record, announcing 3,945 new cases of COVID-19. 61 more people have also died. These dismal numbers come as Ontarians are already bracing for bad news. On Friday, the Premier warned new modelling released this week would outline a scenario so dire, quote, people will fall out of their chairs. He also said more restrictions are coming. No word yet on what those will be, but a curfew for Ontario hasn't been ruled out. Talia Ricci with why some say that shouldn't be the focus right now.
Bob Rodkin is a food courier in Oshawa, Ontario. He's not under a curfew yet, but if one is brought in, it could mean getting stopped by authorities while making late-night deliveries. Still,
If that's what's the government and the medical people that they're consulting with feel is necessary, then I'm fine with that.
And with Ontario's cases surging, a curfew is a possibility.
Everything's urgent.
Last week, the Premier said everything was on the table. Spain, Italy, Switzerland, and France have all implemented curfews. Researchers in France found it worked to slow the spread there. The strongest effect was for people 60 and older, but the data doesn't show why. Here at home, experts are split on whether a curfew is the right move for Ontario after 2 weeks of a full provincial lockdown.
So really, the next step in all of this is that if you want the cases to go down, you actually have to do something more.
The social gatherings around Christmas clearly were an impact to the hospitalizations, but Christmas is over. Like, this is not the solution. Like, we need paid leave, we need rapid testing.
Workers' advocates agree, saying paid sick leave for essential workers should be the priority, not a curfew.
We know that it's racialized, low-wage workers and mainly women of color who are doing this work. And the last thing they need is to be harassed by the cops on their way to or from work as to why they're on a bus.
Which raises another curfew consideration, mental health.
My main concern is the rise in psychological distress, anxiety, depression, substance abuse, and domestic violence.
Even before today's new record high number of cases, Ontario health officials were calling the situation scary. New modeling will be presented on Tuesday. No word on when new restrictions may show up. Talia Ricci, CBC News, Toronto.
Let's bring in infectious disease specialist Dr. Zane Chagla now. And Dr. Chagla, you have some concerns when it comes to curfews about unintended consequences.
Yeah, absolutely. I mean, I think you could get people congregating more during the day than the night. You have now probably limited hours in terms of grocery stores and other settings, so you may have more capacity in those places. And recognizing that there is going to have to be more enforcement to these communities, particularly for people that don't work a 9-to-5 life, the people that are scarcely housed, they're going to encounter police and enforcement. And knowing those communities are already racialized, those communities are already fiscally unstable, you know, there's going to be enforcement actions that may not be completely what we want as a Canadian society.
And you know, we can look at some other jurisdictions that have already imposed curfews. Are there any lessons there for provinces in Canada that might want to follow suit?
Yeah, I mean, I think you need to make it absolutely clear. You have to have good reasoning. I give you a Australian example, which introduced an extremely strong curfew, but they also had significant human rights abuses. They locked up an entire apartment complex, and so you really do have to balance what you do for human rights and really the communities that this is going to disproportionately affect.
Dr. Chagla, we'll be talking to you again later in the show. Thanks.
No problem.
CBC News has learned Canada gave up its option to acquire 16 million more doses of the Moderna vaccine against COVID-19. But the minister in charge insists plans are still in place to meet solid targets. Here's Ashley Burke with today's revelations.
Exactly 4 weeks ago, the first doses arrived. Since then, while 500,000 have been delivered to Canada, just over half of those have made their way into arms, according to third-party trackers. But some provinces say they're not getting it fast enough.
All of Ontario will be out of Pfizer vaccines by the end of next week. My friends, we're all hopeful the federal government will get us more vaccines.
Every day that somebody is not inoculated is a risk, particularly in the high priority groups. It can even be a risk to their lives.
Even so, Ontario and Alberta have been criticized for sluggish rollouts.
There is a real ramp up happening right now.
Today, the minister in charge of buying vaccines told Rosemary Barton Live she doesn't need to approve other vaccine candidates to inoculate everyone by the target date.
If all we end up with is Pfizer, BioNTech, and Moderna, do we have enough to get this done by September?
We will have enough. We will.
Okay, good.
And we will be on track, without doubt, to ensure inoculations for all Canadians who want it by the end of September, if not sooner, right? That is the goal that I'm pursuing every single day, moving up that end of September timeline so that we can see ourselves through to the other side of this pandemic as quickly as possible.
Canada has access to 60 million doses of the Pfizer, BioNTech, and Moderna vaccines, enough to vaccinate 30 million people. Tonight, the minister's office said Canada allowed its option for another 16 million doses of Moderna to expire, but is still in talks with Pfizer for more doses, which are more difficult to ship. Canada also has access to other vaccines if they're approved. Another sign the rollout is ramping up, the federal government has now awarded a $16 million contract to accounting firm Deloitte to improve how it manages and tracks the vaccines and who's getting them. Ashley Burke, CBC News, Ottawa.
Frustration is growing over why it's taking so long to vaccinate one of Canada's most vulnerable groups. Of this country's roughly 17,000 COVID deaths, almost three-quarters have been in long-term care homes, but only 10% of residents have been given shots. Some experts now say they should have been given priority, even ahead of frontline medical staff. That's what Israel and Denmark did. Canada did have enough doses to vaccinate every retirement and long-term care home resident in the country by now, with tens of thousands of doses left over. But Canadians with loved ones in long-term care homes remain frustrated and angry with discussions around the rollout strategy. With deadly outbreaks across the country, they want action. Briar Stewart examines that part of the COVID story tonight.
Outside of a care home in Toronto, a small protest demanding the government do more to protect those living in long-term care homes, which are being ravaged by COVID-19.
What we saw in the first wave and what we're seeing in the second wave is that people are dying.
We can't allow more seniors to continue to bear the brunt of this pandemic when they should be the ones we care for.
Nearly 3,000 residents have died from the virus in Ontario. The provincial government vows to vaccinate all those living and working in care homes by January 21st, but only in 4 COVID hotspots: Toronto, Peel, York, and Windsor. Officials in Niagara believe it should be included too.
If I look at the cases per population basis, Niagara is actually very similar to Toronto's caseload now. And looking since December 21st, we have had 70 deaths in long-term care home residents.
Across the country, hundreds of care facilities have struggled with outbreaks. At Little Mountain Place in Vancouver, nearly 90% of the residents here caught COVID. More than 40 of them have died. It's BC's deadliest outbreak.
Care facilities really do not staff adequately for the care needs of the patient, and the pandemic has really brought that to the forefront.
Dr. Maria Chung has been in a care home after an outbreak and believes health authorities need to find a way to allow more visits by family members, because some residents are not only missing an emotional connection, but much needed physical care as well.
If you're not maybe getting fed for an hour and you start losing weight, and then it becomes a vicious circle, you get weaker, you're more likely to not eat.
Which is why she believes the true toll of the pandemic is much greater than just the number of residents who've been infected. Briar Stewart, CBC News, Vancouver.
For the first time, a Canadian NHL team cancelled activities because of potential exposure to COVID. The Vancouver Canucks' decision for today comes as the NHL prepares to start its new season on Wednesday. And as Austin Grabish explains, for all 31 teams, the virus could be their most challenging opponent.
Here's Virtanen down the right wing, picked up the puck, going to the goal. Virtanen to the backhand, they score.
On the ice, without fans, the Vancouver Canucks were getting ready for the start of the 2021 season. That's just 3 days away. But abruptly, today, the team canceled practice after a potential COVID-19 exposure.
This could be an absolute, bomb to some teams if they can't clear it up over, a 1 week or a 2 week period. If it goes on for an extended period of time, we're talking about basically a wasted season for these guys.
Vancouver is the 4th team to have its training camp affected by COVID. On Friday, the Dallas Stars said 6 players and 2 staff members had tested positive. The same day, the Columbus Blue Jackets kept 19 players off the ice after a scare. And on Saturday, the Pittsburgh Penguins canceled practice for the same reason. Unlike last summer, when the NHL had strict bubbles in 2 cities and players in isolation, this time the rules are more relaxed. Teams in the Canadian division will be traveling and playing in several provinces. Even with stringent testing, this infectious disease expert says there is a risk.
Here, there's too many other open avenues where someone can get infected and infect the whole group.
And hockey fans have their own thoughts about the league's plan.
Having all the teams traveling all over the place doesn't seem like a smart plan. Probably would have made sense to do another bubble situation.
The Canucks aren't giving any details about this scare. The team announcing tonight its practice Monday morning will go ahead. If all goes well, the Canucks will face off against the Edmonton Oilers on Wednesday. Austin Grabish, CBC News, Winnipeg.
Coronavirus deaths in the United States are on pace to beat the record set just last month. In the first 10 days of 2021, at least 28,000 people in the U.S. died of COVID-19. At that rate, there could be as many as 89,000 deaths this month alone. Last month saw 77,000 succumb to the virus. The previous benchmark was just over 60,000. That was set in April. But for many, the tragedy has been overshadowed by the attack on the U.S. Capitol. Today, former Defense Secretary Leon Panetta, who served under President Obama, spoke with Rosemary Barton, accusing the current president of inciting the mob and called for him to be removed.
It's going to be very difficult, either operating with the 25th Amendment or even impeachment to actually accomplish that effort. But at the same time, perhaps it might send a signal to this president that it might not be a bad idea to resign soon, allow Vice President Pence to take over so that we could have some sense of confidence that we aren't going to see a repeat of what we saw this last week.
And tonight, those efforts are underway. Katie Simpson now on the campaign to impeach.
After days of public shaming, the White House has finally lowered its flag in honor of the police officer killed in the Capitol attack, and now a second member of the same force who died reportedly by suicide this weekend. The occupant inside this building remains quiet. With his social media megaphone stripped away, the president has hunkered down as calls for his removal get louder.
Donald Trump represents a clear and present danger to the health and safety of the American people.
Democrats will spend the next 24 hours trying to compel the vice president to invoke the 25th Amendment and have the president removed from office. If it doesn't work, they will bring forward articles of impeachment, which would likely be approved by the House before the week is over.
But there is strong support in the Congress for impeaching the president a second time.
The matter would then need to go to trial in the Senate, and 2/3 of senators would have to vote to convict Trump if he is to be punished. Trump's term would likely be over by that point, though members could vote to ban him from ever holding public office again.
Well, I think the best way for our country, Chuck, is for the president to resign and go away as soon as possible.
Trump supporters argue the president has learned his lesson.
My personal view is that the president touched the hot stove on Wednesday and is unlikely to touch it again.
The consequences of Wednesday's attack continue to expand, as this may soon be marked as a COVID superspreader event, a fear long on the minds of lawmakers.
I also saw a small group of Republicans, of course the most conservative Trump allies, proudly refusing to wear masks even in this incredibly crowded room.
The top doctor on Capitol Hill says some lawmakers sheltering together were exposed to someone who has since tested positive. President-elect Joe Biden takes office in 10 days. If an impeachment trial starts soon, it would tie up the Senate, meaning Biden wouldn't really be able to start his agenda, get things done like passing a new COVID relief bill. If an impeachment in the House happens, Democrats may wait 100 days before sending it over to the Senate for a trial, so Biden can get some things done first. Katie Simpson, CBC News, Washington.
An engine has been recovered from that Boeing 737 that crashed off the coast of Indonesia yesterday. The flight was traveling from Jakarta to Borneo when it went down in the sea. 62 passengers and crew were on board. All are presumed dead. Also discovered today, the jet's flight recorders. This disaster is Indonesia's worst since the 2018 Lion Air tragedy took 189 lives. And Pakistan was plunged into darkness overnight after an electrical plant shut down, and that started a rapid chain reaction of power outages across the country. They have managed to get the power back on, but officials are now looking into the cause of the massive blackout. The country's energy minister saying the power infrastructure has not been upgraded in years. More from our doctors coming up shortly. We'll ask them how they feel about lockdowns. And we'll talk more about the effectiveness of curfews and where their patients say they're catching COVID.
and they apply it to the lid.
The clever Canadian contraption, he says, was ripped off by Tim Hortons. And why this preschooler got a shout out from New Brunswick's top doctor.
Because I need to be safe.
We'll be right back. When a pair of rookie inventors came up with a special coffee lid applicator, they thought it was a good idea. And they claim so did Tim Hortons, but they just couldn't make a deal. So imagine how surprised the two were when they stopped one day for a coffee, surprised enough to go public. Here's Diane Buckner.
Father and son team Yolande and Sean Talbot thought they had scored an incredible deal with Tim Hortons.
It was just to find a way to have a safe coffee.
At the start of the pandemic, Yolande saw a server handle his payment, then the lid of his coffee cup.
It has to be a different way.
He designed a hands-free beverage lid applicator to reduce the risk of COVID contamination.
Essentially, the barista would hold on to the ring and they apply it to the lid, and then it's applied to the coffee.
They applied for a patent and were thrilled when executives at Tim's asked for hundreds of samples to be tested in stores.
Every step it received 100% approval rating.
There was talk of a purchase order worth as much as $800,000, but the deal fell apart in July over exact pricing. The Talbots moved on to make sales at other restaurants. Then a few weeks ago, they stopped to get a coffee at a Tim Hortons just outside Toronto.
At first, quite couldn't believe it.
Servers were using a similar device, not theirs, in a different color. And it turns out it's in use at a number of locations across Canada. In a statement to CBC News, Tim Hortons says multiple vendors submitted similar inventions. It's absolutely not true they took the Talbots' design.
They're virtually identical.
But this independent product designer says the new Tim's device looks pretty much the same as the Talbots' invention. Kevin Bailey tried an experiment. He asked 3 of his firm's designers to create lid applicators to see if the ring design is so obvious multiple designers would think of it. They even made one of them.
But the design is significantly different than these 2 designs, and so were the other 7 designs.
Yolande and Sean Talbot are beyond disappointed.
They hold all the power. You sign their contracts. You give away your intellectual property rights, and that's something that we never signed.
They could consider suing Tim's, but only if their patent is eventually granted. And if they can afford the expense of a lawsuit, they may not win. Diane Buckner, CBC News, Collingwood, Ontario.
And don't forget, our Go Public stories come from you. So if you have a tip for the team to investigate, send an email to gopublic@cbc.ca. Up next, our doctors tell us where their patients are catching COVID. We'll chat about that and the return of the NHL. Can it be done safely? Plus, healthcare workers talk about the pivotal moment they got the vaccine. Welcome back. As case counts hit record levels in some provinces, governments have been considering some extreme restrictions. Quebec now the first province with a nightly curfew beginning at 8 p.m. In Ontario, Premier Doug Ford says all options, including a curfew, are under consideration. BC's restrictions on gatherings will remain in place at least until early February. All of this comes as officials are also keeping a close eye on variants of the virus spreading. And we're joined by infectious disease specialist Dr. Zane Chagla and Dr. Lenora Saxinger. And doctors, both of you have expressed concerns about the COVID numbers in your province. So let me start with you, Dr. Saxinger. Do you think a curfew would be an effective measure in Alberta?
You know, it's really hard to know how much a curfew would add. When you go out and about in the evening, which I don't, but if you happen to run some errands, it does not look super active at that time of the day. And the whole issue is, will a curfew make it clearer for people to decrease their number of contacts with others and provide a bit of a harder endpoint for people to measure against when they're deciding what they should and should not do? There's some jurisdictions where it does seem to be quite helpful. And I think that, you know, it can be on the table if you're having problems for sure, but you'd want to follow up and see if it's actually doing what it needs to do.
And Dr. Chagla, it sounds like it may be on the table in Ontario. From your perspective as a doctor, do you think a curfew is the right way to go?
Yeah, I think the folks that are congregating after 8 o'clock, can find a way to congregate one way or another after 8 o'clock with or without a curfew. And I think we really do have to think seriously of what the downstream effects of a curfew are. There are still many different things that are not being addressed in Ontario's response in terms of sick pay, access to testing, access to safe isolation, community supports. I think if you haven't really squeezed the juice out of that lemon, going down the lines of curfew and saying you're going to just resolve some gathering isn't necessarily going to give you the benefits that you want and really cause some downstream effects.
Something I'm really interested in hearing the answer to. Both of you in your practices are speaking to people who are infected with COVID, have just gotten the news. Dr. Saxinger, first to you. Where are they telling you they're getting it?
Well, it's quite a range. I've definitely had people allude to, pre-Christmas interactions or, dropping off presents at the door, unmasked brief encounters. And quite commonly, people don't really describe much by way of risk activity. And then sometimes you hear things about, workplace gatherings and workplace spread, certainly. And so it's quite a range still. But to be honest, I do wonder if there's a bit of minimization potentially when we're asking that history.
Yeah, can you imagine how hard it is for the contact tracers to try to get straight answers to that? Dr. Chagla in Hamilton, what are patients telling you about where they're getting COVID?
Yeah, absolutely. I think there was some activity over the holidays. There is people that may not be entirely truthful because of the stigmatization around this disease. But there's also family members, people that, again, go to workplaces, come home and infect family. Healthcare workers, unfortunately, that have gone home and infected their family. And so, yeah, it's a myriad of different settings, some of them that are preventable and some of them that really aren't, given some of the transmission that's occurring.
Two other topics I want to deal with before I let you go. And Dr. Chagla, let's start with you on this. The NHL season is supposed to start in just a few days. Today, the Vancouver Canucks announced they were canceling their practice because of potential COVID exposure. So not as a hockey fan, I'm asking you to answer this as an infectious disease doctor. Do you think this is a good idea to have the 7 Canadian teams traveling across the country playing starting this week?
Yeah, last year was great. In the NBA and the NHL, they put it in a bubble. As long as you controlled everything going in and out, you really made a very safe concept. With players now in their own homes, interacting with their families, interacting with the public, unfortunately, we're going to see transmissions occur in the NHL, and it's just inevitable in that sense. The hope is with repeated testing that it doesn't have rippling effects. And I think with the repeated testing as well, it's not likely going to have effects in terms of significant community transmission. So, I think we have to give it time to see if this model works. It's more humane for the players. There's a huge platform here to communicate with people that haven't been reached by public health measures. But, we do have to reevaluate. If we're seeing significant transmission, then maybe reconsidering the season back in a bubble to end it.
And Dr. Saxinger, I can't have you guys on the air here without asking about the variant. Lots of concerns out there. How do you feel about the existence or likelihood of the variants spreading in Canada?
Well, I think it's very, very concerning because the data that's come forward is actually pretty consistent that there are variants that seem to spread more effectively. They don't necessarily make people sicker, but if it spreads more effectively, it affects community transmission a lot. A lot more people get sick. So it has effects. We're right now trying to figure out whether these are actually actively spreading in Canadian communities. A lot of the labs are working on higher speed surveillance testing to see if we can screen for the presence of these, because I really do think it would change things. If either the UK variant or the South Africa variant are actually becoming common in the community, we really have to up our game in terms of the prevention of transmission in the community as we're rolling out vaccine. So I would call myself concerned and watching closely.
All right. Dr. Saxinger, Dr. Chagla, thank you very much for spending time with us.
No problem.
Pleasure.
Though there are lots of questions about the pace of COVID-19 vaccinations in Canada, some healthcare workers are getting their shots, and that's sparking some emotional responses. A pair of Toronto doctors told us what the vaccine means for them and their hopes for other Canadians.
My name is Yona Krakowski. I'm a urologist at Women's College Hospital,
My name is Dr. Marina Goltz. I'm an inpatient psychiatrist at Mount Sinai Hospital.
Okay, ready?
Ready. Yesterday, I got the COVID-19 vaccine, and the experience was painless and seamless.
Documenting myself getting the COVID vaccine was important because it felt like a pivotal moment in my life and career as a healthcare worker. After months of worry about contracting and spreading the virus, I wanted to let my family, friends, and colleagues know that I was safe and that they would be protected against COVID-19 too in their interactions with me. I also wanted to encourage people who were hesitant to get the vaccine to do so.
Being able to get this vaccine so quickly was particularly meaningful to me. In April of last year, my grandmother, living in long-term care in her 90s, was unfortunately diagnosed with COVID-19. We couldn't visit her, we couldn't comfort her, we couldn't say goodbye to her. Unfortunately, she passed away, and none of us could even attend her funeral.
Being able to get the vaccine so quickly was a relief. I have been looking forward to this moment for the last 10 months. I lost my grandmother in the first wave of this pandemic who lived in long-term care. I look forward to other vulnerable populations being able to receive this vaccine.
Getting the vaccine now after these months represents to me that fewer people will go through this experience. The isolation of the pandemic and the morbidity and the mortality will hopefully soon be behind us.
The last 10 months have been grueling. Myself and many colleagues are experiencing fatigue, burnout, and uncertainty. Getting the vaccine now has re-energized and motivated me to keep going.
What I want others to know is that the vaccine was painless. The data suggests it's completely safe and effective.
I know that people are scared because it's new and they don't know what to expect. But I have seen firsthand the effects of COVID-19 on relatively young and healthy people. The vaccine presents new hope, and that in combination with social distancing and wearing masks will help to end the pandemic.
Up next, a CBC News investigation into the connection between a noted Canadian philanthropist and the mob. How a savvy billionaire could be pulled into the world of organized crime. And well, you probably didn't know who he was, but you knew how he sounded. A look at the life of Canadian keyboard wizard Michael Fonfara.
I'm Jamie Poisson, and tomorrow on CBC's daily news podcast Front Burner, the social media ban on U.S. President Donald Trump and what it says about the power big tech holds. Subscribe wherever you get your podcasts.
5 years ago, the National and the Fifth Estate had a documentary look at how one of Canada's business titans got involved with the mafia when he tried to invest in Dominican Republic casinos. Although Michael Degroote denied involvement with the mob, in recent months an Ontario court battle has produced some shocking audio tapes that appear to prove that was not the truth. Terrence McKenna picks up the story.
Michael Degroote became one of Canada's richest men with shrewd investing of the fortune he amassed in the trucking business. Now he is honored for his philanthropy with the Order of Canada and the Michael Degroote School of Business, the Degroote School of Medicine, and the Degroote Pain Clinic at McMaster University. In 2011, he decided to invest over $100 million in a chain of casinos in the Dominican Republic operated by two Canadian brothers, Francesco and Antonio Carbone of Woodbridge, Ontario. He decided to overlook the Carbone's gun possession convictions in his desire for quick profits. Before long, Degroote decided the Carbones were cheating him and wanted his money back. He first turned to the courts, and then his underlings took increasingly desperate measures. They sought help from the infamous feared Montreal mafia godfather Vito Rizzuto, who also had property and businesses in the Dominican Republic, and who at the time had just been released from years in jail on a U.S. murder charge. When our first investigation aired 5 years ago, Mr. Degroote denied that he was complicit in members of organized crime becoming involved in any of his business affairs, and claimed that he has never met Mr. Rizzuto, has never spoken to him, and has never had any association with him of any kind. New evidence suggests that was not the truth.
You can record my conversation with you.
Well, it's being recorded by both of us.
Okay, perfect.
Right.
Audio tape evidence just submitted in the Ontario court battle over the business dispute provides an astonishing portrait of how even a billionaire can be drawn into organized crime.
How long has Rizzuto's been giving you money? How much money you got from him?
No, this is with the lawyers and police chiefs. $150,000.
In the tape of a strategy meeting with his trusted advisors, including Dream Casino president Andrew Pajak and executive Ed Krambluski, Degroote agrees to make an initial payment of $450,000 to mafia godfather Rizzuto for services the Degroote team had requested in the Dominican Republic, including bribes to Dominican government officials and judges.
You know what the fees for paying judges? Unbelievable. And you have to bid.
I'm going to die here on my couch. Liquidate them and pay these guys $450,000. That's the first money you get your hands on it. Make sure $450,000 gets paid to these guys.
Degroote and his executive team, including James Watt, speculate on the advantages that will come with a business partnership with Vito Rizzuto, and even the potential murder of their opponents, the Carbones.
So we have to make a decision. And not you, Mike. But we still have the Carbones to deal with. They said they'll deal with the Carbones because the Carbones will never be allowed into the country. Right, so.
Yeah, they're going to kill them. That's what happened.
Yeah, Carbones won't go for that.
They'll be dead. They won't have much choice no matter.
I don't think they're going to have any choice after a while.
Okay. You're having to be a gym for a bit.
In another room, Degroote's closest longtime advisor, James Watt, pulls him aside and pleads with him to come to his senses and not get into a partnership with Vito Rizzuto.
You know,
What do we do now?
you're not getting into the bed with the mob. You can't do it. Imagine taking this conversation to your kids or grandkids, because it never ends there. These guys aren't doing this because they're nice guys.
I also can't tell them I'm not getting a bit of a thing because then I'm coming to target.
That's, well, if not from one side of the mob, it's the other side. At some point in time, the mob will deal with your side of the family.
And see, they become the shareholders. I'm just a debtor.
You can't get into bed with the mob, directly or indirectly. You were in the toughest business that there is, trucking and garbage, and you stayed away from them, I think for a reason.
I'm not getting bed with the mob. The shareholders are getting bed with the
Mike,
mob.
no, you're rationalizing.
Yeah, but if I say no, I got a gun to my head anyway.
No, they don't. There's no gun to your head.
In the meeting, Degroote finally agrees to a partnership with the mafia boss Rizzuto, but says he does not want the Carbones dead, just thrown in jail.
And they're going to be in jail by the time we're finished, believe me, with all the fraud that they've committed and all the thievery.
You don't have a pleasant life to look forward to.
No question they're going to jail. It's any satisfaction, I'm going to get out of it for $100-something million to get them in jail. That's my goal.
Antonio Carbone did end up in jail. He was arrested in Punta Cana on a dubious charge and has spent the last 5 years in Dominican prisons. We visited him there in 2017.
The lead investigator in the case is currently under house arrest, which is Isidro Vasquez for corruption. And the judge who sentenced me to 1 year prison preventiva is Margarita Cristo, which 3 weeks ago was fired and removed from her position as a judge for corruption.
I've gotten threats personally. So.
Have you? Meanwhile, Carbone loyalists decided to fight fire with fire Degroote executive Ed Krumblewski's son's house in Toronto was targeted with gunshots from a passing car.
They're not going to go through his house anymore. They're going to go through his fucking head.
Why are you threatening me? I can't even do anything.
And then he received this threatening phone call from Mike Razzo, who has family associations with the Carbones and Toronto biker gangs. The Carbones say they had nothing to do with it.
You live in the Dominican Republic, but your family is not. How the fuck are you able to protect them from where you are? And obviously, police don't scare us. We don't care. So, do you want to be the cause of bad things that happen to your family? Because I'll tell you what, I'm not going to kill anybody. I'm not going to kill a single person. I'm going to break fingers. I'm going to break toes. I'm going to cut their thighs. I'm going to cut their eyebrows. I'm going to cut their lips off their face. I'm going to do all these very terrible things because this is what torture is. Please. I'm being a very, very, very respectful man to you. And I'm saying please. Get rid of these charges tomorrow. At 5 p.m., the charges are not gone. Bad things are going to happen. And I'm going to come down there. And when I come down there, I'm going to come and get you. But I'm not going to kill you.
Well,
I'll dismember you.
Mike Razzo pled guilty for the threats against Degroote executive Ed Krumblewski, but claims the audio was doctored. The infamous Montreal Mafia godfather Vito Rizzuto died of cancer in 2013, shortly after his business dealings with Michael Degroote. Michael Degroote's family applied to the court to have him declared incompetent due to dementia, and the court accepted. When we asked Degroote's lawyers about the tapes, they said any suggestion Degroote tried to subvert justice or counsel violence is inaccurate. They continued to insist Mr. Degroote had no association with Mafia godfather Rizzuto. Almost 10 years after Michael Degroote foolishly invested over $100 million in Dominican casinos, his family is still fighting in Ontario court to get the money back. Terrence McKenna, CBC News, Toronto.
Coming up, a change of pace, a mid-press conference shoutout makes a little girl's day. How Reese's masked-up dolls caught the attention of New Brunswick's public health officer. But first. Musicians are mourning the loss of Ontario-born keyboard wizard Michael Fonfara. You may not know the name, but you've likely heard him play. Foreigner hired him in 1981 to add to the sound of their smash hit. And Fonfara was Lou Reed's go-to guy on 9 albums. Also a 50-year member of Canada's legendary Downchild Blues Band. That's him from last year. Downchild co-founder Donnie Walsh said in a statement, "He's the best musician I ever worked with. If you met him, you loved him. A creative genius."
Now that you've left me,
At home in the background and open to all talent.
We get these guys that come down and sit in with us, the best. Really fine musicians. They live here in the beaches, and if they get a night off or an afternoon off when we're playing here, they come in and they sit in with us.
Fonfara died in hospital on Friday after a 2-year struggle with cancer. He was 74. These dolls belong to a little girl in New Brunswick who got a very special mention from the Provincial Chief Medical Officer of Health. During Dr. Jennifer Russell's update on Friday, she took a pause to acknowledge 3-year-old Reese's commitment to keeping herself and her dolls COVID safe. Her shout out is our moment.
I just want to acknowledge there's a little girl out there who's watching right now whose name is Reese, and she has put masks on her dolls. And I just want to acknowledge that that is a really, really safe thing to do. And good for you, Reese. Good job.
She was playing with her favorite girls, and she said, "Look, Mommy, the girls have masks on. Dr. Russell would be so happy," because she always hears Dr. Russell say to wear our masks.
Because they need to be safe.
They need to be safe. Safe from what?
COVID-19.
And so I thought, oh, that's just so cute. So I just took a quick picture of it and I thought, oh, I'll send that to Dr. Russell. I don't know her, but I said, I'll send that to her at some point and, you know, might make her smile during this time. So I couldn't believe it. I thought it was really, really sweet of her. Reese was so excited to hear Dr. Russell say her name.
And I should point out that Dr. Russell was quoted as saying the next day, I guess that would be Saturday, how gratified she was to know that there was a 3-year-old girl out there putting masks on her dolls because she was following the COVID messaging in her province. Really special one-off thing. Carrie in our control room said, if she put a mask on a doll, would she get to be the moment? In a word, no. That is the National for January 10th. Good night.